Hey everyone, welcome back to Discussions with Dr. G. I'm Dr. G, your friendly neighborhood nurse who somehow manages to survive teaching pharmacology to bouncy university students and occasionally even to my cats. Today we're diving into a topic every nurse and honestly every human should care about: health disparities. Even if you're just here for the fun stories, stick around because what we're talking about affects every kind of family, every kind of community, cats included. All right, so let's get to it. You've probably heard about Healthy People 2030. If not, it's the Olympics of public health goals. The big headline: eliminate health disparities and achieve health equity. Sounds nice and tidy, but the reality is it's a bit messier. What shapes these disparities? We're talking everything from race, ethnicity, sex, sexual identity, age, disability, socioeconomic status. You know, how much money folks have in their pockets and where people live. Geography is sneakily important. Like if you're 3 hours from the nearest hospital, that's going to impact your health. These aren't just fancy textbook words. As a nurse, I see how these factors mess with health indicators and for real people. Access? Well, that depends on your zip code. Adherence to treatment? That sometimes breaks down because families can't afford meds. And it's not about getting sick or not. All of these things. Race, gender, how much money's in your wallet. They change the course of disease, mess with morbidity and mortality rates, and honestly, sometimes draw the line between thriving and just barely hanging on. Now, nurses are all about modifiable risk factors, right? There's a big difference between what you can change, like quitting smoking or getting more exercise, and what you're stuck with, like your genetics or the decade you were born in. One year I was teaching a smoking cessation class, sort of reluctantly, if I'm honest, because who likes lecturing about cigarettes at 8 o'clock in the morning? Anyway, I remember this woman, let's call her Grace. She told me it was the first time anyone had explained why she was at greater risk for heart disease. Not just because she smoked, but also because she lived alone, on a fixed income, and didn't have a car. That moment, that's when you realize education has got to target the right risks for the right people. And sometimes a nurse just needs to use a dry erase marker or bad drawings to explain it. It works every time. Okay, so now that we've got what causes health disparities, let's take a peek at how these show up in different groups, because the details, they matter. Let's start with older adults. Everyone knows older folks grapple with stuff like diabetes, heart disease, Alzheimer's, and honestly, arthritis so bad you'd think it was trendy. But there's more. There's things like limited transportation, structural racism, losing social networks, and if you've ever tried to get a ride to an appointment for someone who doesn't drive anymore, you know that's a struggle. Massive caregiver burnout is real. Then there's women. Lots of us think about breast cancer, but let's not skip ovarian, endometrial, and cervical cancers. It's the whole reproductive health circus. Women are also dealing with osteoporosis and all the drama that comes with contraception options. Yes, tiers 1 through 3. Don't get me started on remembering which is which while racing down a patient hallway. What about men? Oh yeah, the classic: prostate, lung, colorectal, and even testicular cancers. They are also the not so fun chronic things. Any nurses listening will nod at erectile dysfunction and benign prostatic hyperplasia. And by the way, it's totally fine to still giggle at those terms regardless of how professional you are. And then we have the LGBTQIA community. Stigma, discrimination, and showing up to a clinic and getting a blank stare when you mention your pronouns. These are not minor issues. It affects care. We're talking higher risks for HIV, STIs, a higher prevalence of depression, suicide, and substance abuse. Did you know that LGBTQIA youth are way more likely to attempt suicide and experience homelessness? These numbers are not just numbers, they're stories. I remember working with a teenager who was kicked out after coming out. suddenly homeless, depressed, too scared to ask for help. Nurses in the community, we're sometimes the only lifeline for these kids, which is both heartbreaking and honestly, a job you don't take lightly. Now, all these disparities across all these groups, they shape who gets sick, who gets better, and who gets left behind. Morbidity and mortality, missed appointments, worse outcomes, they're never distributed evenly. And the younger you start seeing these cracks, especially with mental health issues among LGBTQIA youth, the more important the nurse's role becomes in advocating and just honestly showing up. You can't fix what you pretend not to see, right? All right, let's shift gears a little bit to the services and support systems that are out there, because knowing what's available can literally change a patient or a family's life. Adult daycare centers. These are absolute lifesavers, offering both a safe spot for older adults to socialize and not just watch daytime TV, and a break for the caregivers who need, to remember what sleep feels like. You might have heard the alphabet soup around insurance. Medicare Part A for hospital stays, hospice, and some home health. Part B for outpatient care and preventative services. Part C, right, that's Medicare Advantage. Think of it like a slightly fancier buffet with extra options. Very similar to what most younger people carry. Okay, and then there's Part D, which is for prescription meds. Then you've got Medicaid. That's based on how much you make and who's in the family. It's supposed to help low-income folks, people with disabilities, older adults, pregnant women. Then there's this double whammy, dual eligibility. If you qualify for both Medicare and Medicaid, you're probably really vulnerable and juggling paperwork like it's an Olympic sport. End-of-life care isn't one size fits all either. Law actually protects your right to make healthcare decisions thanks to the Patient Self-Determination Act. That's why advance directives matter so much. So do living wills and those durable powers of attorney. Underrepresented groups are less likely to use hospice care, but more likely to experience unrelieved pain. Got chills? Me too. Hospice is comfort, dignity, interdisciplinary support. Palliative care means managing symptoms right alongside active treatment. And now, for the caregiver reality check. There are like 53 million caregivers stomping around the U.S. right now. Most are women, and honestly, a good number have health issues themselves. Compassion fatigue, depression, burnout, not to mention the financial strain. These are literal everyday battles. That sandwich generation thing, taking care of both kids and aging parents, it's a full-time job plus overtime, plus their regular job. I remember a family I worked with trying to find Medicaid support for their elderly grandparent. The paperwork is ridiculous. There are wait lists and lots of late-night phone calls. But as a nurse, I knew my best role there was to advocate, disentangling the mess so that this family could actually breathe. Nurses, you're not just supporting the client, you're supporting the people who hold everything up behind the scenes. All right, hopping off of my soapbox, I just want you guys to know it's the health disparities, the unique challenges, and all the behind the scenes advocacy work that nurses in the community pull off every day that really matters. And I want to thank you for letting me get a little nerdy and, well, a little real with you. So next time we're going to dive even further into community health. But until then, take care of your people. And don't forget to nap when you can.